In this podcast, we will speak about the age-related dermoscopic nevus patterns. Studies suggest that the number and the dermoscopic patterns of nevi vary with age. Based on epidemiologic studies, we know today that nevus count increases from puberty until midlife and thereafter decreases. Yet, the topic of this podcast will be delivered in 4 separate parts, which are related to the main periods of life. These main periods of life are childhood, adolescence, adulthood, and late adulthood. It is advisable to listen to these 4 podcasts beginning with part 1, followed by parts 2, 3, and 4. In part 1, we will speak about the dermoscopic nevus patterns of childhood. Childhood is defined as the period between infancy, about 1 to 2 years, and pubescent, which starts around 9 to 14 years. The great majority of nevi in children will exhibit an uniform globular pattern, like in this case shown a uniform globular nevus. Childhood nevi may also reveal overlapping features with congenital nevi, such as terminal hairs and keratin cysts. In this example, we see a globular nevus with an increased number of terminal hairs. In this other example of a globular nevus, we see some milia-like cysts which are indicated by the white arrows. Because of these overlapping features, childhood nevi are also sometimes considered as tardive congenital nevi. Other synonyms are congenital-like nevi, early acquired nevi, or globular nevi. Now, due to the physiologic growth of a child, childhood nevi tend to enlarge over time. However, they usually maintain their dermoscopic globular pattern. In this example, we see a globular nevus consisting of uniform and densely aggregated globules. And if we look at the baseline image, we can see that this globular nevus is small. During follow-up, it enlarged, but it maintained its globular pattern. A few globular nevi are seen, however, through all different age groups. Although globular nevi are the most prevalent pattern in children, a few globular nevi can be seen also in adulthood, but also in the elderly, which led to the concept that globular nevi are highly stable lesions that persist for most of the lifetime. In summary, childhood is the period of onset of persisting globular nevi.